Back on our show this Monday. It's good to have Oday Lavergne back with us from Agilus Health. And Oday, welcome back. Good to have you.
Good morning. Welcome. Thanks for having me again.
It's nice seeing you on the set, Oday.
Well, it's always nice to be here. Cheery faces.
Good way to start the week. Huh?
Always a great way to start the week.
Big ruling, state legislature, I guess last week, couple of weeks ago.
Talk
about that a little bit.
Yes. Senator Fred Mills from Breaux Bridge authored a piece of legislation for the physical therapists that finally passed after about, I don't know, I've been working on this for about 38 years now.
To be exact.
Yeah, to be exact, but nobody's counting. And you know, it's nothing's more powerful than an idea whose time has come, and I think now is time. So we refer to this piece of legislation as patient access, okay? So patients now can have access to go to their physical therapist without having to go to a physician first. Huge, major deal here for our patients and citizens of central Louisiana and Louisiana in particular. You know, we were one of the last states to do it. 43 other states have patient access to physical therapy.
Why do you think it took so long?
Oh, politics, Mark. It's just politics.
This is Louisiana.
It is Louisiana. Politics is a participative sport here.
Let me ask you this now. When does this go into effect?
It is in effect as we speak.
Really?
The governor signed it. Last week we saw over at least a half a dozen patients that just saw it on the news. Thank you guys, and walked in and said, listen, I'm having problems, and now that I don't have to see my doctor, this is way more convenient, and they just came in, and we can take care of their problems. You know, in 200 million other people in America had better access to physical therapy than the citizens of Louisiana did. And so this model of healthcare is the model in the rest of the free world. And in the military, physical therapists are the triage. You go to physical therapy first. So if you now in Louisiana, if you have any type of pain, musculoskeletal or otherwise, headache, neck pain, back pain, you can't move, can't sleep, want to get in shape, want to play tennis better, all you got to do now is just give us a call.
So how is this affecting the physical therapist centers?
Well, I think it's going to make a positive effect. You know, number one, is going to help us help people save money. All the statistics said that there's a 50 to 86% cost savings by being able to access physical therapists first instead of practicing wait and see medicine and everybody else getting a shot. And then for the most part, it was, well, if nothing else worked, well, let's try physical therapy. Well, instead, you can try physical therapy first now. And, you know, some real alarming statistics. In America, we represent 5% of the global population, and we take 80 to 85% of the opioid drugs. You don't need opiates in order to get to feeling better. It's a proven fact, but we take way too many pain pills and pain medicine and pain prescriptions in America, so it's about finding the problem, going to the source of it, managing it, and fixing it.
Well, it sounds like also that you may have the opportunity to fix the problem sooner. With this access.
Absolutely. In so many instances, we weren't seeing people till after they had spine surgery. I mean, instead of trying something non-surgical first, we were having to wait to after everybody else had their turn and nothing still worked, then it would fall in our laps to try to get these people better. And so it's just it's going to be an amazing thing. It
sounds like a huge cost savings.
Oh, it should be a tremendous cost savings, you know, and pain and suffering. Why wait? Just come on in and get taken care of. And so today, in today's healthcare, people want to make their decision. Whether they're going to traditional medicine, or they're going to do functional medicine, or regenerative medicine, or physical therapy, or chiropractic, or osteopathic medicine, or see a naturalist. You know, in many other states, there are 20 different options. In Louisiana, you know, there's not so many options.
And so now the patient has the deciding factor which route they want to go.
That's correct. And in most households, the mother, the wife, the female makes 99% of the healthcare decisions. So now when mama wakes up and says, this is where you're going, you put on your shoes and you go and you listen to her, because it's just common sense. We just have to use our common sense.
Oday, where Agilus Health is located in central Louisiana?
Yes, we have an office on Texas in Jackson, and we have an office in Kings Country Shopping Center in Pineville, and we've been here for 38 years now.
Easy to find them.
It is
easy to find.
Thanks, Oday.
Thanks.
It's great seeing you on the set this morning.
Appreciate it.
More to come. Dr. Sabrina Starling joins us in just a second.